Hello, good morning, good afternoon, good evening, at whatever time you may be watching this. My name is Jim St. Clair, and I'm thrilled to be able to be here as part of this conference today, introduce my two colleagues, and have a meaningful conversation on the topic of COVID credentials, health passports, where they are, and of course, their relationship to healthcare and blockchain. I am the Executive Director of Linux Foundation Public Health, and have been active in the areas of healthcare and blockchain for several years. And I'm thrilled to be joined by two colleagues and foremost experts on the topic, Marie Wallace from IBM and Drummond Reed from Evernym. I'm going to take a minute to introduce each of them, and then we'll get into some more discussion specifically around this concept of credentials and COVID passports and its relationship to healthcare and blockchain. First of all, Marie Wallace is a senior architect at IBM Watson Health. Many of you may be familiar with the tremendous accomplishments that IBM Watson Health has made in healthcare in general, as well as many of their significant contributions specifically around blockchain, both in healthcare and in other industries. Drummond is the Chief Trust Officer for Evernym. Evernym is a major service provider in the areas of decentralized identity solutions, and it cannot be overstated how much Drummond has had an influence over the last 20 years on the underlying concepts for decentralized identity and the applications of blockchain in that area. And we'll spend a few more minutes on that as well. Marie, Drummond, welcome, and thank you very much for your participation today.
Thanks, Jim. Glad to be here.
Great to be here, Jim. Looking forward to it.
Thank you very much. First of all, let's kind of introduce and set the scene. We're talking about this idea of health passports and COVID credentials, and we're relating it to the topic of blockchain and healthcare. In this particular discussion, and I know you've already seen some really good discussions so far about blockchain, decentralized ledgers, decentralized technology being applied to other healthcare processes. Here, we're focusing around the aspects of how to manage critical information for attesting to your COVID status, your vaccination status, while at the same time enforcing the principles of privacy and consent to share your information that many of you may be familiar with in other blockchain type applications. In particular, we're referring to something here called self-sovereign identity or decentralized identity. Self-sovereign identity is as much a philosophy as it is an architecture, and it believes in the concepts that the individual has the sovereignty, the control over their identity and aspects of their identity at all times, and set up sharing models for how their identity is used for different points of verification. Of course, I'm sure everyone's familiar with showing your ID card when you go into a bar and having to disclose PII, personal identifiable information. Moreover, we have to deal every day with, logging in with Facebook or logging in with Google, which serve as really centralized management authorities for your identity. In moving into this world of decentralized identity, you're empowered with technical capability to manage attributes of your identity, and the underlying controls behind that, certainly the most mature underlying control frameworks, are built around decentralized identity using blockchain technology. Specifically to healthcare, there are several companies, several initiatives, and several programs that are looking for how decentralized identity helps put you in charge of your electronic health data and then be able to manage privacy and consent to share that data. And obviously for today's discussion, we're focused on the very hot topic concerning vaccination passports, COVID credentials, and the like. And I'd like to turn it over to Drummond for just a minute. Drummond, you and I, of course, are very active, as well as Marie, in the Trust Over IP Foundation. Could you speak just a couple minutes at a very high level around Trust Over IP and the framework there, and then we can steer it into COVID credentials?
Sure, Jim. The Trust Over IP Foundation started about 18 months ago, IBM was a founding member. There were, I think, 27 organizations when we started. We've now got 10 times that number of members. That's how strong the interest is in decentralized identity, what we call decentralized digital trust infrastructure. And it's built around a concept we call the Trust Over IP stack, which is is really, fairly straightforward to describe. It's a 4-layer stack of the protocols needed to have very strongly cryptographically verifiable digital credentials that we can use for every aspect of establishing trust online. And Jim, you used the term self-sovereign identity. That's used a lot within the space. That tends to make it sound like you're talking about identity for people. Absolutely, we're talking about identity for people, but with trust over IP and the stack, we're talking about decentralized digital trust infrastructure for everything you need to interact with. So it's absolutely identity and credentials for organizations and departments and everything within an organization, but also for digital things of all kinds, IoT devices, medical devices, but also digital twins of anything else that needs to be tracked and have verifiable attributes about it, such as products and services. So all of this, of course, when you're talking about sensitive data involving individuals or their medical history, or the healthcare providers, the doctors and hospitals, all the information that's flowing through their systems. If you want to have that information all to be cryptographically verifiable, to have it so the provenance of the data can be tracked, and the rights to the data can be very clear wherever it is, that's what we're building the stack for. It is layer one is what we call cryptographic public utilities. Blockchains, we'll probably talk about several examples. IBM's been building one. Marie can tell you about that. The second layer is the digital wallets and what we call the agents that work with those digital wallets, whether they're all the way out on a mobile device or they're in the cloud. But the digital wallets that store the keys needed to cryptographically digitally sign the messages and the data being exchanged. The third layer is where we have the digital credentials, what we call the trust triangle of issuers of digital credentials, holders in the wallets, just like we hold physical credentials in our wallets here like this, and then what we call the verifiers that make requests of, can you prove the following information from a digital wallet? That bar scene that you talked about with a digital credential, you would literally like scan a barcode with your phone, entering a bar, and the only information you need to prove is that you're over the legal drinking age in that state or jurisdiction. And that's all that they would need to know and all that they would find out. And of course, it'd be a very, very fast and very, very highly secure process. And the fourth layer is what we call the application layer, and where you can build entire digital trust ecosystems based on verifiable credentials exchanged between all of the participants. And that's where we're seeing a lot of focus. And I know we'll talk more, Jim, about the whole digital trust ecosystem project we did around the Good Health Pass.
Mm-hmm. Absolutely. That's a fantastic overview. And I think one of the things that resonated with me is, if you look in the context of HIPAA, the Health Information Portability and Accountability Act, I think what you're really suggesting, Drummond, is the ability to assign those principles of privacy and consent sharing with health data, no matter where it may be in the organization. And especially, you mentioned provenance, how that provenance can be back associated again with the patient who owns that data and for whom that data is reflecting.
Absolutely. The last point I should make about the trust over IP stack is, yes, it's 4 layers, classic protocol stack for technology. And the other half of the stack is governance. How do you have an associated governance framework for being able to trust the technology and the participants you're dealing with at each of the 4 layers? And when we talk about utility governance at layer 1, a wallet and agent governance frameworks for certifying wallets and agents at layer 2, credential governance frameworks, just like the governance frameworks that cover the credit cards that we use every day on the MasterCard and Visa networks. And then layer 4, ecosystem governance frameworks. And that's where we really get to things like COVID credentials. As you know, there's an entire initiative called the COVID Credentials Initiative as part of Linux Foundation Public Health. And that started literally about 30 days after the COVID crisis hit. the decentralized identity community and SSI community said, we're going to need credentials to work our way out of this. And so that's where CCI started, eventually went to LFPH, and has been a major part of the work on Good Health Pass.
Absolutely, and I'm thrilled to work with them. With that being said, Marie, you've been a tremendous contributor with CCI in LFPH and in Trust Over IP Foundation. I'd love to turn to you now and talk about specifically your applications in IBM and what you're working on with COVID credentials.
Yeah, sure. So I'm actually coming from a data science background. So I've been about 20 years building AI solutions and specifically focused on personal analytics, recommendation systems, health analytics, things like that. And one of the things that's been really frustrating for somebody, and anybody who's a data scientist will recognize this, is people say there's loads of data, but actually it's really, really hard to get access to good quality, reliable, trusted data, and specifically data for an individual. So if, for example, I might be somebody who's got specific health issues, I want to be able to leverage all of my data in order to maybe understand how I can live a healthier life, how I can, have longevity. So there's a lot of analytics that we want to be able to do, and it relies on an individual being able to provide that data that might be in multiple different places. So right now, there's always been this belief that the data supply chain as it currently stands is basically coordinated by large entities, large companies, these data aggregators. It might be social media companies, it might be, EMR vendors, it might be, it's large companies that have lots and lots of data. And it's not always easy for the individual to get access to all the data about themselves. So that was what really attracted me to this whole idea of self-sovereign identity, decentralized identity, because it completely flipped everything on its head. It basically said, let's create a data supply chain where the person is at the center. And this is something we at IBM have been hugely interested in for quite a while because of the privacy preserving aspects of that and the control from the individual. And then what happened is COVID came along, and all of a sudden, anybody who's been in the space will know everybody started to recognize that, oh my God, we're going to have to do something around decentralization because centralized systems are not going to work. Centralization of health data might work when the only people that need health data are other health entities. So one hospital needs to share information with another hospital. You can maybe do that through these large, traditional health data exchange models. But if you have a scenario where you have a restaurant needs to get access to your health data, or an airline, or at a stadium, or an employer, you've got these, potentially thousands of entities that want to basically access health data. You do not want all of those pummeling health institutions to try and get access to health data and then try and track consent. So this is where the person has to be at the center. And that's really what we've done with IBM Digital Health Pass. So IBM, working with our colleagues in Trust Over IP and its foundation, and we've been, working through these ideas, and we've built something called the IBM Digital Health Pass, which is built on this fundamental idea that when somebody gets a vaccination or they get a test or they have any health data, that they basically can have that data on their device, in their hand, as a verifiable piece of data that they can share with a third party. And that third party can trust that the data is valid. It hasn't been tampered with. So if I want to tell my employer, or I want to tell a restaurant, or I would tell an airline, I'm fully vaccinated, they don't have to go back to the healthcare institution where I got the vaccine. They can trust from the credential I'm sharing with them that I am indeed vaccinated. So this has been really, really important, I think, in the COVID crisis, because what it started to do is I hope it started to allow individuals to feel comfortable with holding their own data, feel comfortable with being able to share it in a very controlled fashion, minimize the amount of personal information that's exchanged. And then it also helps companies who don't want to be dealing with health data. They don't want to be storing loads of health data. So it also helps them be able to, meet regulatory requirements around, making sure people are vaccinated before they come back to work without them having to become big healthcare data stores, which is what they don't want. So that's really what we've tried to do with IBM Digital Health Pass, to try to make this healthcare data exchange much more equitable and much more patient-centric and easier and more reliable. So that's really what we've been building in IBM.
Fantastic. I want to key in on two things that you mentioned. Number one, the idea that you can trust the data I'm giving you. Again, that concept of provenance that Drummond was referring to, that this data is cryptographically verifiable. And at the same time, the second concept that I control the data that I'm sharing. So you have both the ability to enforce your privacy and consent, while at the same time, when you do share data and maybe only one element of data, like yes, I've had a vaccine or no, I haven't, and no other details beyond that, it's in a method that can be trusted cryptographically and verifiably. Drummond, in thinking about that concept, that relates to what I've read before about privacy by design. And I know you've spent time with Dr. Ann Cavoukian talking about it. Could you give just some highlights of privacy by design and how that kind of fits into this concepts of control and sharing for data?
I'd love to. It's one of my favorite topics in the whole space. One thing I like to point out is Dr. Cavoukian, who still is working on privacy by design since she, over the 20 years after she created it. There's a wonderful example. When we use these to share information about our identity, they actually wonderfully incorporate many things, aspects of the elements of privacy by design. First of all, I'm at the center. I only put credentials in this wallet that I agree to put in here, that I qualify for, and then I make the decision about when I share it with someplace else. I keep this information with me. I protect it. I'm the one who gates access to it. And so I'm confident that it remains confidential and in my possession. What we are doing with, decentralized identity and self-sovereign identity is we're saying, okay, that's wonderful, but I can't share that online. I can't do that remotely. I can't prove to someone. I can't do a video conference and, show this. So I need to be able to do it with a digital device. And that's what requires, and as soon as you put the data into a digital form, it becomes, as with all other things, digital. Anytime you share it, you're sharing a complete copy of it instantly. It'd be like every time I showed a driver's license, the bar was taking not just a copy of it, and you've probably seen that before. They want us to stick in the copy machine. I don't allow any bar to do that. But imagine if they actually got a direct copy of your credential that just went in the bar and the bouncer's hand, right? That's what we can't have with digital credentials. They need to be digitally signed by the issuer of the credential, but then bound to you as an individual. And then you're the one that needs to be able to control when what we call a verifier is asking for information. They need to prove whether, as Marie said, and you said, it's like it is a credential. Even though I was issued a driving license, for instance, a digital driver's license, I might want to use it to prove my age and only share that one piece of information. Someplace else, I need to prove my address, and I only want to share that information. And then, if I'm stopped at a traffic stop, I need to be able to prove my driver's license and share everything. That control over it and building that into the technology so that my digital wallet is smart enough to be able to do it, and basically turns into a tool for constantly helping me protect my privacy. That's an extraordinary opportunity. And I like to share that when we sat down a few months ago, Ann and I were on a panel together, and she said, Drummond, I want to learn a lot more about this. I had 3 follow-up sessions with her, by the end of which she said, this is how we're going to do privacy by design at internet scale. And that's why I'm so enthusiastic about the use of the technology in healthcare, because, Jim, as you know, it's HIPAA compliant, it's GDPR compliant. In fact, it solves problems that, for instance, the right of erasure. How do they know it's you when you're wanting to ask for data to be erased? With this technology, you can actually digitally sign the request to say, yep, you knew it was me. I signed the data to begin with, and now here I am saying this is what I want, erased. So we're very enthusiastic about what it can do to revive privacy on the internet and certainly in healthcare.
That's fantastic. And just to kind of reemphasize that, then the underlying technology for being able to facilitate that architecture is blockchain. And I think, Marie, I think that you're familiar with the blockchain side from IBM. Obviously, Drummond and I have worked a bit with the Hyperledger Foundation and other organizations that promote blockchain standards. Could you comment a bit just on the IBM architecture and how you leverage your expertise in blockchain for that solution?
Yeah, so what we fundamentally did is while we adopted the basic principles and the design, the philosophy and the architecture of trust over IP, We and IBM, obviously, we have Hyperledger Fabric, and we use this for a lot of enterprise use cases. So it kind of made a lot of sense for us to basically leverage Hyperledger Fabric. So instead of using Hyperledger Indy as an example. But what we want to do is to ensure that it can participate in the identity ecosystem the same as any other ledger. So what we've been doing over the last year or so is we've been adding some capabilities, like the universal DID resolution, for example, to Hyperledger Fabric. We've released our DID resolver for the IBM Digital Health Pass and the ledger that we're standing up for all the credentials that are ecosystem issues. So we very much believe that there's not going to be one single ledger, and in fact we work with a number of different partners who are using multiple different ledgers and ledger technologies. I think it's to the point Drummond made earlier. It's about these layers of the network. There's never going to be a single ledger underneath, but what we want to try to do is make sure that we're interoperable across the ledgers, and that's kind of what our position has really been. We want to ensure that we're as interoperable as possible, and not just with multiple ledgers, but also maybe non-blockchain technology. So for example, there are self-sovereign solutions out there that maybe don't necessarily leverage blockchain under the covers. And from our standpoint, we want to be interoperable with everybody. So I think really it's a case of, to me, the most important thing on a personal level is have the right philosophy. To John's point about privacy by design. There's a fundamental philosophy around decentralized identity and an architecture. And sometimes I hear people talk about it, and they use the word, but the architecture of us is completely different. So I think for us, it's the first and foremost understanding how this is supposed to work, the self-sovereign nature of it, and that no PII is on the blockchain, as an example, is one of the basic premises. Those are the fundamental things that have to always happen. And then exactly what type of blockchain technology you use is a personal choice.
Fantastic, well said. And I'd like to go back and focus a minute more on that topic of governance, that the highest level of the TOIP framework that Drummond was talking about. Obviously, when we're getting into this discussion around COVID credentials, governance is a huge issue. And to your point about philosophy, again, being in a travel environment, trying to manage worldwide travel and travel requirements, understanding proof of health as being part of that, but not wanting to share health data with your travel agent or with your airline, and of course your airline not wanting your personal health data. So building a governance framework that helps control that and leverage the technology that both of you and I have been talking about and the principles of blockchain there. In CCI and obviously together in our work in the Good Health Pass Collaborative, Marie, I would love to get your perspective a bit from sitting in Dublin on how the EU is working with this. And of course, then we can talk a bit about Drummond and Evernym and IATA and their perspective internationally too. You've been very active, Marie, in the EU with some of these conversations and how to work with this data. Anything you would share on that topic would be great.
Yeah, so I guess, so what I would say, so Europe, we were maybe a bit slow to get moving, but I'm really impressed and proud of what we've been able to do in Europe, because I think one of the things that has been fairly impressive is one is, as an entire block, the entire block is consolidated around a certain set of specifications for how credentials are going to be generated, what they're going to look like, what information is going to be contained within them. Every member state obviously has its own regulations, and every country is slightly different in terms of from a jurisdictional standpoint what they do and do not put in there, or what they allow, how they allow it to be used. But I think fundamentally, the advantage that Europe has had is that at least all the countries in Europe are sharing a common specification for how the data is structured and what data is put in there. And then with the EU Gateway, what they've put in place is at least a synchronization mechanism. So every member state can contain their own trust registry, and at least there's a synchronization mechanism for the different member states via the EU Gateway. I think and this is where I'll hand over to Drummond in a second, because I think the interesting challenge is, so while the EU has done a really good job of its boundaries, the EU as a region, what we have is we really have this need to be able to not just look at Europe, but look at the whole globe. So in the United States, as an example, it's a little bit less, there's no kind of universal agreement. I think, a lot of states use smart health cards. You've got others using other formats. But at least I think that the challenge I see we have right now in Europe is we're doing really well. We can travel easily within the States. It's very easy to verify. We all carry our digital certificates around with us all the time. We just got used to it. You go to a restaurant, you swipe your card, and off you go, and you have a nice dinner, and you come back out again. So we kind of gotten used to it. I think the interesting challenge is if you look at a lot of European countries, if I'm Irish, I can go and I can eat out in the Irish restaurants. If I'm an American tourist coming to Ireland, I can't necessarily easily eat out because I don't have proof of vaccination. So I do think we really have a big challenge that needs to be addressed, which is how can we allow people to move flexibly across borders? That's not just from the US to Europe, but obviously Asia, Africa, the UK, and different places. What we have seen is the EU, because they've released their specification, and some actually non-EU countries are actually starting to adopt it. But we still then, even if they adopt the specification, that doesn't mean they're in the EU gateway. So they still have a trust registry challenge. So I think the whole issue of a network of trust registries is actually fundamentally critical that we get this addressed sooner rather than later if we really want to allow credentialing to be a global phenomenon as opposed to just something constricted to a specific region.
Yeah, absolutely. And Drummond, I know that Evernym is very active in supporting the International Air Transport Association, IATA, with their implementation. Could you comment as well, too, on some of these principles of trust registry and things that Marie was speaking to?
It's funny. It's the directly complementary part of it. With IATA, who serves the entire airline industry, it is the organization of the airlines. They recognized very early on with the COVID crisis that in order to reopen international air travel, they would have to have a solution for what they call the IATA Travel Pass. And it goes directly to the problem that Maria highlighted, which is how do we, if you're going to travel to another country, how do you prove that you have the proof of your COVID health status that country requires, and that particular itinerary requires, if you're passing through several countries. So I had to tackle the problem from the standpoint of, okay, what digital credential, technology and standards do we need to do that? And how do we design it to cross those boundaries, right? And they've been very involved in discussions with the EU, for instance, because as Marie just said, and I just had another conversation with the head of architecture earlier this week, the EU has been the easiest thing for them to deal with because the EU basically standardized it within the member nations. The challenge is, okay, all the other countries in the world and the fact that very few others have standardized it in that way. As Marie said, some others are copying the EU because they're saying, oh, that's working. The overall solution that they ended up requiring is to say, all right, we need to take in these different health certificate formats that the governments are getting behind and standardizing, in their countries or across the EU. But we then need to, for interoperability and data minimization, we need to be able to verify those and then turn around and issue what they call an IATA Travel Pass. And that is another digital credential, but it's already data minimized down to just what does an airline need to know, or the airlines on your itinerary, and then it's in, it's a mobile app, so that at any point in that itinerary or junction, you would see a QR code, you'd scan it, it would ask you, will you share your travel pass information with this airline? You just, you give consent, and that's all that's involved. And the airlines are getting only the information they need, but because it's going through the IATA trust framework, governance framework, they know that it is, the information that meets their requirements. And so they, to highlight the same problem Marie did, IATA, to make that works, operates their own trust registry. And that term, when you hear the term trust registry, what it means is the issuers of the credentials are registered with the trust registry, so that when the holder of the credential presents it to a verifier, the verifiers, they can verify the digital signature based on the information. They basically look up the public key on a blockchain. But how do they know that issuer is authorized? How do they know it's a lab that actually is supposed to issue credentials here in Washington State, where I live in the United States. That's what the trust registry does, is the issuers are registered in the trust registry, and software that the verifier is running can quickly check and go, is this identifier for this issuer actually authorized to issue that type of credential? As Marie said, there's we did the work at the Good Health Pass Collaborative to say, this is how it needs to work on an interoperable basis. And now, Jim, as you know, at Linux Foundation Public Health, they've started the global credential COVID credential network to provide a directory of trust registries so that the software can now start to be interoperable on a global basis. And I know Marie's quite active in the GCCN effort as well.
Fantastic. Great overview from you both. And I want to thank you again personally for the discussions today and highlighting this important area. I'll pass it back for 30 seconds and final thoughts, perhaps what excites you the most for next steps or where we're going into 2022. Marie?
For me, I'm excited about, what's next, because obviously, once people are empowered with their own data, they can have it on their device, they can share it, and they can share it in a trusted data minimizing way. What else can they do with their data? So, is there other ways that, for example, like digital prescriptions and making sure, you don't end up taking a drug that you have an allergy against, or that there's negative drug interactions, or, just imagine if whenever you're, filling out prescriptions or getting a prescription, you're checking dynamically with your health record in order to ensure that that's not going to give you a negative reaction. There's an infinite number of ways we can make data work for people if people can feel free to leverage their data. And that's what I'm most excited about.
Fantastic. Drummond, your thoughts?
I'm super bullish on the future for digital credentials and decentralized digital trust infrastructure. When it comes to healthcare, I'm maybe the thing I'm most excited about is what Maria's talking about. When you actually make the patient the point of integration, the hub of integration of their data, and you make it as simple as it's just like using a wallet. And so you've got a smart agent there that is working on their behalf. And we didn't even get into maybe even accessing AI that's working on their behalf, right? You think about Watson. Imagine Watson working for me on my health information and all, what I just ate in the last, it's really going to be, I think, enable leaps forward in healthcare, for the planet, and to be able to be, putting together the plumbing for that. That's what gets me up every day.
Absolutely. And I agree with both of you. It's a great way to leave the audience wanting a little bit more for the next discussion that we have on this. Drummond, Marie, again, as my friends, thank you very much for your time today. Thanks for a fantastic presentation. And for everyone attending Converge to Accelerate, I hope you enjoy the other sessions as well. Thank you very much and look forward to talking to you.
Thank you, guys.
Thank you, Jim.